This is One on One. I'm Steve Adubato. You may know, if you know this series, we talk to healthcare leaders from across the country. We're about to introduce, back by popular demand, Stephen Jones, president of Robert Wood Johnson University Hospital. Good to see you, Steve.
Thank you, Steve. Great to be back again.
So much going on in the healthcare world. We're doing this as we approach the fall of 2013. Are you nervous at all as the Affordable Care Act begins to be implemented? You say, hey, wait a minute, I'm not ready?
Oh, no, I can't wait for 32 million Americans to get health insurance next year. I think it's unconscionable that our country has not had health insurance for the neighbors next to us or our kids perhaps when they graduate from college. It's a great step that 32 million Americans will get health insurance.
But a lot of changes have taken place. We talk a lot off the air about this, and you've said to me that this impending change or these changes have spawned, encouraged, pushed a lot of things. Some hospitals have merged, some hospitals have gone away. But the other thing that's happened is information sharing, information network. More specifically, there is a statewide health information network that did not exist up until not too long ago, right?
Right, being developed right now.
Describe what this state health information network is in terms of electronic records that has potential huge impact on patient outcomes. What is it?
Right. Steve, everybody remembers a medical record, a paper chart in their doctor's office or in their hospital.
Can we get Steve Jones' chart? Right?
Can we get Steve Jones's chart?
Right.
Now, electronic medical records, that information is available right away, online. But yesterday it was only available in one hospital, and hospitals weren't connected. The state has a system of regional health information organizations, and Commissioner O'Dowd,
Commissioner Mary
O'Dowd from the Department of Health and Governor Christie are promoting the development of a New Jersey statewide health information network. That's a great thing, that people's health information will be available wherever they travel in the state.
Break it down. Give me an example.
Sure. An example, Mr. Smith comes into Robert Wood Johnson with an acute asthma attack. He's given a new medication that he never had before, and it helps to control that asthma. When he leaves, that information is in his electronic medical record. He can look it up from home. He doesn't have to ask for a copy of his paper chart anymore. If he enrolls in a health information exchange, he can get that information. His local pharmacy can get that information. It helps with refills. It helps to make sure there aren't medication allergies. That information, as we travel on vacation, we go down the shore they can get our health information if we need help there.
What about if you travel out of state?
If you travel out of state, there are nationally being developed networks. New Jersey is setting up a statewide network, and that's huge for us. It will improve quality, it'll help manage costs, and it'll promote keeping people well and not being in hospitals.
But it's interesting, we keep talking about the New Jersey Health Information Network. Given the fact that we're seeing, obviously, in multiple states, but we have a big audience in New York,
Right.
Do we depend upon other states doing this as well, Steve? So say people are traveling back and forth, Trans-Hudson. You're in New York.
Steve,
Are they doing it too?
There is a national trend with all states looking to develop.
But not every state has this law.
Not every state has
policy.
This. Not every state does, but boy, it's being developed across our country.
Because if you don't, say New York or Pennsylvania, Connecticut, where we're seeing, if the state chooses not to do this, what's the risk?
The risk is I can't get the health information. The doctor who helps me in New York doesn't know that I just had the same lab work, doesn't know what x-rays and tests I had, doesn't know that I'm a cancer survivor because maybe I can't talk and I can't tell them that. But
Risky.
The system will improve quality of care, and it will manage costs much better and promote wellness.
The other thing that we've talked about, and I've done a lot of coaching and I don't want to call it training, but helping folks communicate effectively throughout the hospital world. And I'm always fascinated by doctor-patient communication. Yeah. It's a very important part of this, isn't it?
It's a critical part of this. If you picture the mom brings the child in and wants to make sure that the pediatrician can communicate with mom, perhaps communicate with the child. The biggest question, the most frequent questions I get are, I don't understand the doctor. I don't understand this. And our medical staffs today spend a lot of time working with patients and their families so that their families understand what's going on. It's a great thing when a patient goes home and their family knows exactly how they can help. But that transition in care is important at Robert Wood Johnson. We developed a program over the last several years. We received a major grant from the Robert Wood Johnson Foundation for $4 million to develop a transitional care program.
A transitional care program, what does that mean?
That means when the patient leaves our hospital and is at risk to get readmitted, nationally many patients get readmitted to hospitals within 30 days after they leave. Maybe they don't take their medication. Maybe they don't schedule that doctor's appointment. So we are paying attention to that transition. We have a nurse and our Robert Wood Johnson visiting nurses that will go into the home. We'll schedule your doctor visit before you leave. We'll go into the home and make sure you got those medications. Make sure you have the healthy food that you're supposed to for your lifestyle, because we want you to stay well and not get readmitted in 30 days.
And there's a foundation grant to support that effort?
Robert Wood Johnson Foundation gave our hospital a $4 million grant to help develop our transitional care program.
I want to ask you about mergers and acquisitions happening all over the place. First of all, it's a trend that is not going to stop anytime soon, correct?
It's a trend that won't stop anytime soon.
Okay.
Looking at how we can serve our communities better, how we can promote wellness.
As we do this program, Robert Wood Johnson has something going on with Somerset Medical Center. I don't know how much you can and can't talk about, but as we do this program, what is it? Because people have read some things. What is it? What could it potentially mean?
Sure, it's early in the development, but we were grateful when the Board of Trustees of Somerset Medical Center chose Robert Wood Johnson University Hospital to be their partner. We are developing an alliance with them that will better serve the communities, better serve their medical staff. There's a lot more to come in the future, but we look forward to working with them.
Steve, is it almost impossible in this day and age for a hospital to say, you know what, we're just going to be the best we can be. We're just going to put blinders on, not look around at what's going on around us, and we're going to provide quality patient care, have a great team, have a great fiscal operation, no mergers, no acquisitions, no partnerships. We're just going to do our thing. Doable?
Steve, there are great standalone hospitals in New Jersey, but I think over the next 5 to 10 years, it will be harder and harder to serve your community and to serve your medical staff standalone. We know the cost of healthcare nationally cannot be sustained, that we know we need to promote wellness. That is better done when people work together to serve the community better. It will be hard and harder for standalone hospitals over the next 5 years.
Final question. Is there something unique and different about the healthcare and hospital environment in New Jersey as opposed to New York, Pennsylvania, Connecticut? I mean, you know this business. Is there something unique about New Jersey, or is it just what you just described, pretty much the case throughout the Eastern Seaboard?
Now, at the Robert Wood Johnson Health System and all the great systems in New Jersey, we are focusing on providing value for our customers. We're working collaboratively to make sure we serve our communities. And I think that's a great trend in New Jersey, Steve.
That was well said. Very diplomatic as well. Stephen Jones, President, Robert Wood Johnson University Hospital. Appreciate it, Steve. Thank you.
Thank you very much.
The healthcare and the hospital discussion never ends because it's always changing. It's always important. Stay with us. We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. One-on-One with Steve Adubato has been made possible in part by New Jersey State Nurses Association.